Hello, thank you for joining us and welcome to Health Matters. I'm Sherri Gallant with Alberta Health Services, and we have some wonderful guests with us today. We're going to start off with Eva Streibel. She's a University of Lethbridge alum, and she is a registered provisional psychologist who's working at Lethbridge Counseling Services and in the process of her final evaluation to become a fully registered psychologist. Our topic today is something that I feel is quite timely, and that is ADHD. I think with social media, and I think I've seen a lot on TikTok, it just seems to be top of mind and front and center these days. So welcome, Eva.
Thank you very much, Sherri. It's a pleasure to be here.
Thank you so much for being here. We'll start off with defining it perhaps for the uninitiated. We hear so much in the media, as I mentioned, but what exactly is ADHD?
Yeah, that's a really good question. ADHD is a neurodevelopmental disorder that begins actually in early childhood, and it's characterized by changes or challenges with attention, impulse control, and hyperactivity. If we can take a minute to just look at this chart, we can see that there's several criteria that we use to determine ADHD diagnosis, and these are distributed by the DSM-5. And so we see some individuals will have more symptoms of inattention, others will have more symptoms with hyperactivity and impulsivity, but often we can also have a combination of symptoms. So the important thing is that these symptoms are going to be experienced throughout the individual's life and have an impact on their social, emotional, cognitive, and occupational functioning.
Okay, thank you for that. I noticed that you mentioned the DSM-5, and I wonder if you could just explain what that is for people who may not know.
Oh, sure. The DSM-5 is the Diagnostic Statistical Manual of Psychological Disorders. This is the 5th edition, and actually they've done a revision, so this would be the revision to it. And basically they have a group of psychiatrists, psychologists, different people that get together and determine what a psychological disorder should be based on, what characteristics would help to determine someone had a disorder or an impairment. So,
thank you. That's very helpful. Thinking about the symptoms that you mentioned, what kind of an impact would these symptoms and the diagnosis of ADHD have on someone's quality of life?
Yeah, ADHD can cause a lot of disruption in an individual's life. The wonderful thing is it's considered one of the most treatable disorders. And if treated, an individual can function quite well and be successful in any career that they desire. So that's the really hopeful part of it. The difficulty is if it's undiagnosed or untreated, I hear stories of children and adults who are dealing with lots of frustration trying to stay focused, completing tasks, and even interacting with others. So untreated ADHD can have a significant negative impact on even an individual's sense of self. So a child, for example, is going to experience different symptoms than an adult. Well, similar symptoms, but different impacts to those symptoms. So a child living with ADHD may experience family conflict or peer relationships. They may have few or no close friendships due to their symptoms. Whereas an adult living with ADHD would experience similar symptoms, but the impairments would most likely present as frequent job changes, risky sexual behavior or substance abuse, even financial difficulties, and sometimes even lots of speeding or even car accidents, right? Different things like that. So undiagnosed and untreated ADHD can lead to lots of disruption and difficulties in every aspect of an individual's life. So there's a very important reason why adults should have an assessment completed if they believe they are living with symptoms of ADHD. The impacts of symptoms may become more adverse as an individual experiences major life events. So it's due to that increased stress on the neurocognitive abilities of an individual, and also the severity of the consequences that can happen. As we age, consequences get more difficult. A child who can't focus is not going to have the same consequences as an adult who can't focus.
Right. It sounds like so many people I know. And also, I'll just add that I myself have been diagnosed within the past 3 years or so. And it's been very enlightening. So just how common do we think it is?
Well, would it surprise you to know that 5 to 8 children out of 100 and 4 to 5 adults out of 100 have been diagnosed with ADHD? Yeah, it's pretty prevalent. This frequency is similar across the world. So it doesn't seem to discriminate at all. It's found across cultures, across ethnicities, and socioeconomic boundaries. Interestingly, ADHD is diagnosed 3 times more commonly in boys than girls, but by adulthood, the ratio of males to females with ADHD lowers to 1.6 to 1 or less. And it's possibly due to that stereotypical idea we have of assumptions of behavior for someone with ADHD. Usually it's that hyperactive that we usually think of when we think of ADHD.
That may be more visually prominent in males. Why is it that we're seeing such an increase of an increased number of adults being diagnosed?
Well, the first reason may be that an individual's child has recently been diagnosed. And as ADHD is highly heritable, 10 to 35% of immediate family members of a child with ADHD will also have the disorder. Another reason the diagnosis may be missed is that stereotypical idea of a child living with ADHD as being hyperactive and never able to focus. Children who do not present in this way may be overlooked. Predominantly inattentive presentation may look like daydreaming or lack of skill or laziness or clumsiness, and never considered as an impairment for a child or an adolescent. A third reason may be the differences in presentation of the disorder due to differences in gender and physiology. So difficulty regulating mood can be a significant symptom for individuals with ADHD, which may be explained away as natural changes to hormones, especially for adolescent females and women. And it can be especially difficult for aging women, when they come upon perimenopause. That can be a big influence for women. The last reason we'll discuss today is the possibility of other co-occurring disorders that can complicate an assessment process. For instance, approximately 64% of children with ADHD have a co-occurring disorder, and 80 to 85% of adults seen with ADHD have at least 2 co-occurring disorders. So this can make a concise diagnosis really difficult and may even lead to a misdiagnosis. So for example, especially adolescents can be misdiagnosed with bipolar disorder, or even an anxiety disorder or major depressive disorder due to misattributed systems. You can see in these diagrams how many ADHD symptoms can overlap with other mental health diagnoses. I've just kind of described 3 of the ones that I find most prevalent. So we can see that ADHD and general anxiety disorder have quite a large overlap with restlessness, difficulty concentrating and sustaining attention, low self-worth, irritability, sleep disturbance, challenges with school, work, and/or relationships, suicidal thoughts and attempts, and even headaches. We see similarly with major depressive disorder, and you can see there's a lot in the center that are really common. Being easily distracted, having a low tolerance for frustration, sleep disturbance, fidgeting and restlessness. Again, suicidal thoughts and attempts, difficulties with relationships, impaired memory, low self-worth, irritability, headaches, and low motivation. And the last one I want to emphasize is actually post-traumatic stress disorder, because trauma can have a really significant effect on and has very similar symptoms to ADHD. So we see that overlap can, again, easily distracted, have a low tolerance for stress, frustration, sleep disturbance, fidgeting, restlessness, challenges with relationships and work and school, suicidal thoughts and attempts, impaired memory, so low self-worth, irritability, headaches, and even low motivation. So we can see there's a lot of similar symptoms that can be across different mental health diagnoses.
Incredibly complicated.
Mm-hmm.
For the person and the professional who's who's assessing, I imagine. What should an individual do if they suspect that either they or someone they love, regardless of age, may have ADHD?
I was anticipating you would ask me this question, so I have 6 recommendations. So let's start with the first one. First of all, just find out more about ADHD, what the symptoms are, and the criteria for the diagnosis. As I mentioned, ADHD is considered the most treatable mental health disorder. There are proven medical, psychological, and behavioral interventions to help individuals better manage their symptoms and find success with their ADHD neurodiversity. The Canadian Resource Alliance for ADHD can be a great place to begin to learn information. Number 2, speak with your doctor or mental health professional, such as a psychiatrist or psychologist, who can help you complete the assessments for ADHD and also assess for other medical or mental health issues. That's really important. Number 3, 98% of individuals diagnosed with ADHD as adults began experiencing the presence of symptoms before the ages of 12 to 16. So talk with teachers, coaches, babysitters, and other family members to get their perspective on you or your family member's symptoms. A thorough assessment for ADHD will include a lot of information, including observations made by those who know the individual best. Number 4, look for additional resources that may help you understand your ADHD symptoms better and find ways to manage and adapt that work for you. There's so many wonderful resources out there, including mental health video series, books, podcasts, and even magazines. Number 5, reach out for and establish good supports like a coach or counselor that specializes in ADHD. You're not alone in this journey of neurodiversity, and there are supports for those who are living with ADHD and those with family members who are living with ADHD. Check out resources like the Psychological Association of Alberta or Learning Disabilities and ADHD Network as a start. And number 6, look for your strengths and be patient. Getting assessed for ADHD will take time, often several months, as information is gathered and other medical or mental health conditions are considered and ruled out. You've come this far and may have developed some wonderful and creative strategies for managing your symptoms. So just celebrate those strengths and successes and continue looking for answers.
I love that last part there. I would really concur that although there are many frustrations, it can be a gift in many ways. And once it's fully embraced, I think it's easier to see that. So thank you for this wealth of information and some guidance on how people can seek further information. And thank you so much for giving us your time today.
You are most welcome, and thank you for the invitation. It was a pleasure to be here.
Thank you. Our pleasure. Up next is Keiji Mori. She's a public health dietitian with Alberta Health Services, and we're talking about another very timely topic, I believe, which is mindful social media use on the topics of diet and health. Welcome, Keiji. Thanks for your expertise today.
Thank you so much, Sherri, for having me. It's a pleasure.
Let's start off on defining what is mindful social media use. What is it? What does that mean? And why is it important?
Yeah, so that's a great question. Mindful social media use refers to being aware of what and how much energy we give to the social media content we watch. While there are many benefits to social media, including having quick access to information and being able to connect with others, heavy social media use can be particularly damaging to our mental health. Now, this is relevant to nutrition as most online messages are not science-backed and are made by college students and millennials as opposed to qualified health experts like registered dietitians. Online messages about nutrition and weight tend to glorify certain foods and ways of eating over others, and so can compromise our self-esteem. Although it's not practical to give up social media use entirely per se, we can practice mindfulness around what we watch by reflecting on the way posted videos, pictures, and even captions make us feel. Now, this includes, for example, content promoting quick diet fixes, body transformations, or other similar messages that can lead to thoughts of self-comparison, judgment, and even unworthiness. A first step we can all take is to be critical of where the information is coming from, to unfollow creators that don't make us feel good, and most importantly, to seek information from qualified health professionals.
Okay, so that's some great advice. Who do you think is most vulnerable to this kind of messaging on nutrition and diet and health?
Yeah, so that's another great question. Diet messaging does affect us all. However, young adolescent females tend to be most vulnerable for several reasons. One, they tend to be the largest consumers of many mainstream social media apps, but also because females tend to be more sensitive with their bodies and feel greater pressure by predominant and mainstream messages in society to look a certain way. This can increase the risk for unhealthy perceptions and behaviors around food and weight, eating disorders, as well as a negative body image. Nutrition and diet content on social media primarily promote unhealthy eating and toxic, what we call diet culture, whereby thin bodies are idealized and shown over larger ones or ones of different sizes and shapes. Due to the large volume of diet messaging on social media, some apps have actually recently gone to the steps of creating censorship policies so that videos and posts with potentially triggering eating disorder content can be flagged. Now, this is great and all. However, young adults, because they are exposed to a lot of social media, they may not necessarily be able to discern the difference between credible versus non-credible information, or be even critically assessing what it is they're watching. In fact, a recent research study analyzed 1,000 TikTok videos on nutrition, food, and diet and found that only 1% of videos were created by qualified health experts in the nutrition field, such as dietitians, and only 3% included messages where bodies of different sizes and shapes were shown.
So true. And I'm mindful, speaking of mindfulness and mindful consumption, I'm mindful of how so many of the people that are younger people are watching on social media are called influencers for a reason, because they are influencing behaviors and habits. And you know, it could be a good idea for folks when they're watching to be mindful that maybe a lot of these people, when they're endorsing habits, diets, products, are actually getting paid and receiving perks in the form of products and memberships to do that. They may not even believe what they're saying, but it might be to their advantage to promote something or other. So with your expertise, what else can we do to be more mindful with how we consume our social media?
Yeah, so another great question and excellent points you bring up there, Sherri. One of the first steps to being more mindful with social media messages and with content we are engaging with, particularly around food and diet, is to be aware of how much time we spend on social media first of all, and also what we give our attention to. Many settings on our phones can track this. However, we can also determine this more simply by just taking a step back and reflecting on where we give and spend most of our time. Now, another tip to keep in mind is that most social media content is heavily filtered, and so is not an accurate reflection of reality per se. That is, a single post or video may not, and often doesn't, reflect someone's true, authentic selves.
Okay, so true. What are some strategies that we can use to navigate around our social media use on food and nutrition and diet content?
So some helpful strategies to help us be more mindful with social media include, first off, to curate our social media accounts to include health promoting platforms. And this can be done by unfollowing individuals that promote diet culture. Secondly, we can follow platforms that embrace body positivity, diverse body types, and health at every size. Thirdly, we can check to see if the person providing information is a qualified health professional. Now, this can be done by looking to the creator's profile and checking their credentials. And whenever possible, we can turn to nutrition experts for credible nutrition advice. Additionally, given the influence that prolonged social media use can have on our thoughts and our feelings, we can aim to try to limit how much time we spend on social media by having breaks, perhaps a few days or even a few weeks. And lastly, by fostering self-compassion. This can be done by surrounding ourselves with positive health role models.
So true. And once a person takes that step to being strategic and choosy about who they choose to follow, as we know, the algorithms will then start to give them similar sources. So they will just automatically receive more qualified sources to watch if they start to choose that. And that's a kind of a magical thing as well. Casey, thank you so much. This is so helpful. I think I'm going to save this and make it available for some young women in my life. It's really good advice. Thanks for your time and your expertise.
You're most welcome. Thank you, Sherri.
Thank you. Stay with us. We will be back in a moment. Welcome back. And just like magic, during the break, we popped over here to Urban Grocer, a lovely little neighborhood grocery store on the south side of Lethbridge. And I am joined by Victoria Hecker. She is a registered dietitian with Alberta Health Services, Nutrition Services, and she's going to bring her expertise to us to let us know some ways that we can start saving money on our grocery bill, which I think is on everybody's minds these days. Welcome, Victoria.
Thank you so much for having me.
It's so good to have you here. Let's start right at the beginning. What can we do to start saving money on our groceries?
The first thing I would do is take some time at home to plan out what you want to eat all week. Think about which days are busier and when you might need some quick and easy meals to get you through the week. Also think about making some extra food to have leftovers for the days you really don't have time to cook. If you do this at home, you can take a look in your pantry and your fridge to see what you already have so you're not buying too many things. If you're shopping online, this can also work because you can see what is in your pantry before you add it to your cart.
Good stuff. We have a few stores, like we're in one. There's many grocery stores in the city. Do you have any tips on comparing stores?
Absolutely. If you have many stores near where you live that sell food, you can compare prices, but also think about how far away these stores are and think about how many different ones you have to go to get the right price. Sometimes it might be more money you're spending on gas to get all of the way across town. So often your local grocery store, the one down the street, might be your best choice too.
That's a lot of good stuff there. You mentioned, figuring out the price. What can you do to figure out what something costs and what the prices are?
Absolutely. The best way to compare similar foods, if it's a food that you are going to need to buy, is taking a look at unit price. So many foods come in different sizes of packages. And if you're comparing a package that is much larger than another, it can be difficult to see how much a bowl full of that food will cost you. So unit price compares the same amount of food, whether it's 100 grams, a kilogram, pound, or 100 milliliters. So it's the same unit of weight or volume. If we have a larger package of food, often the unit price will be lower because we're getting more food per packaging. So if you take a look at the unit price, often on the bottom right of the price tag, you will compare the same amount of food, whether it's 100 grams or 100 milliliters.
So like with cereal, you're comparing cereal to cereal, apples to apples, and getting a good sense of what you're actually eating.
Exactly. Yeah, apples for apples or bowl for bowl. The same size
bowl for bowl, yeah. So you're doing all the detective work and figuring out the prices and the unit price. How do you know how much you've actually spent on food?
Good question. Sometimes I like to bring a calculator or a smartphone with me to the store. That way I can calculate unit price myself if it's not listed on the tag, or I can add up everything I'm putting into my cart so that I know how much I'm spending before I hit the till. This is also really easy to do if you're shopping online because it does it for you. So before you finish the order, you can check how much you're spending.
That's brilliant. Any other information on what we can do to save?
I would recommend taking a look at how much packaging your food has. Sometimes you're paying for a lot of packaging, especially if we get individually packaged items. So take a look at whether you can buy in bulk for a lot of foods. Bring your own containers to the store. Often stores will let you do that, and then you don't have to buy any packaging at all. Or your own bags to the store. When you buy in bulk, you also only buy the amount that you are going to use. So sometimes that can help you save money too. And finally, when you get home, think about food waste. A lot of times we buy vegetables and fruit with great expectations and plans to cook them, but we have a very busy week and we sometimes just don't get to it. So often we may be able to justify spending a little more on some things that are already chopped up and ready for us to go. If that helps you eat it, sometimes that's worth the extra cost. If you've prepared too much food, make sure that you store your leftovers properly. Package it up in a reusable container and consider keeping it in the fridge for 3 days or frozen up to 3 months. The tighter you lock it and the safer you store it, the more likely that you're going to eat it on time. Also, make sure to label it with a date so you know how long it's been in your fridge or freezer.
And sometimes not only for that time, but just to remember what the heck it is in that container.
Yeah, exactly. Many of the soups and chilies we store in the freezer can end up looking a lot the same after a little while. So it doesn't hurt to take a little extra time and label it.
Well, thank you so much. This is extremely helpful. I know that I've struggled with a lot of these things myself, and probably our viewers are feeling the same way. Thanks a million.
Thanks so much for having me. And if you do want more resources on this topic, I can recommend going to www.ahs.ca/nutrition resources. We have under the healthy eating tab a lot of good information on healthy shopping, healthy grocery lists, and reducing food waste.
We love to talk about that site on this show because it is a wealth of good stuff and recipes, and you can just roam around in there all day and find the greatest things. We'll also put some other links up on the screen for you, and next time we go shopping, it might be a different experience. Thanks for joining us, Victoria. Thank you for joining us at home. Thanks to all my guests today for bringing us a great, entertaining show with wonderful information. And we'll see you next time on Health Matters.